Hi. Today I'm going to be giving an intramuscular injection to an infant. So, first off, I would definitely perform hand hygiene. That would be number one. And second, I would arrange all my supplies, which I've done so here. And normally I'd also go to the medicine drawer and pull everything out from the medicine drawer, the automated system. But I already have everything here, so we'll skip all that. And you would normally prepare one med for one patient at a time, but I have everything here ready to go. And I've selected the correct med from the drawer, which would be the first check. And then I would compare the drug label with the MAR for my second check, so I would compare the drug label with the MAR. Everything matches up. And I would also state the rights of the patient, which would be right patient, right med, right dose, right route, right time, right reason, and right response. So then I would want to calculate the dosage correctly and double check to make sure there's no errors or anything like that. So in doing all the calculations, I'm supposed to be giving an injection of hepatitis B vaccine. And it just, the solution strength is just, I'm going to say I have to give 0.5 mLs intramuscular once. So then I check the expiration date. This is a brand new bottle. And for immunizations, I would have to document the expiration date, the lot number, and the manufacturing company, just so if anything goes wrong, you know exactly where it came from. Now I'd want to determine the correct syringe and needle size for an IM injection for an infant. Now, the needle length would be about a 1 inch, but for today we're going to pretend this is the 1 inch. And it would be like an 18 to 21, 22 gauge needle, which we'll say that we have here. And then normally before returning the med to the drawer, I perform my third check of patient's rights, which would be once again right patient, right med, right dose, right route, right time, right response, and right reason. Return the meds to the right spot in the med drawer and make sure the card is locked. I'd identify the patient, use a double identifier, so I'd use the MAR, compare it to the name, and then compare the patient's number with the name and the date of birth, everything with the MAR. Now I'd select the appropriate injection site, which for an infant would be the vastus lateralis. So what I would do is I would feel the hip and the patella, and then I would pull down the skin and then push up the muscle and inject it there. So yeah, so now I would apply clean gloves, and I would want to verbalize my landmarks, but for an infant, you'd still do it like, say, if the family member or mother was there or something like that. Once again, avoiding any compromised areas, bruising, open areas, sores, etc., etc. So, the order says to give 0.5 mLs of the Hep B vaccine, which I have here. Brand new bottle. You really don't need to wipe off the top since it's a brand new bottle, but we'll humor say that I'm doing it. So, circular motion, if it was new, drop it. So the needles that we're using today, we don't have the correct ones available, so we're using these insulin syringes, so they don't have a safety lock. So if I was going to recap it and drop it in the sharps, if there wasn't one right nearby, I would recap it off of the table itself. So I'm going to give 0.5 mLs. I would draw 0.5 mLs of air. Inject the solution, inject the air, withdraw the solution, making sure there's no bubbles. Withdraw. And normally you'd have like a sheath or something you could pull up which would protect you, but we don't have that here, so for my sake I'm just going to recap it with off of the table. So also, normally I would also want to change out the needle, because inserting the needle into the bottle itself would dull it. And also you want to be giving the solution directly into the muscle, and if you didn't recap the needle, some of the solution would go into the subcutaneous tissue in the skin and might cause inflammation or redness or something like that. So I have my needle, I have everything drawn up. So I would explain, if the family's there, explain what I'm going to do. And I would expose the area, the vastus lateralis. So I would feel for the, my hands are really big, so I would feel for the hip section and the patella. And what I would do is I'd pull the skin down and then kind of push up the muscle so that the muscle is exposed and there's no risk of hitting bone or anything like that. So I found my spot, wipe it with alcohol, allow it to dry. Normally we'd hold the alcohol swab in my hands, but since I have everything here, I just put it down. Uncap the syringe, and once again, pinching it down, pulling it up. I can't inject it, so I'll just pretend I'm doing it in there. At a 45 to 90 degree angle, pull it down, lift up the muscle, inject it quick like a dart. You're not going to aspirate because this is a vaccine. Pull it up, you'd resheath it with the safety. But we don't have that here, we'll just pretend we did it. And then you dispose of this in the nearest sharps container. Just right there. And then applying a gauze to the area with gentle pressure, making sure you don't massage the site. So apply pressure, maybe 30 seconds or so. I dispose of the needle and the cap, apply pressure, and then I would cover the area up. Just remove my gloves, I'd perform hand hygiene, and then I would come back in to evaluate the site. And if there was a lot of discomfort, maybe like a cold or warm compress for comfort, and verbalize my intent to come back and keep an eye on the site, like with the family. And then I document the medication administration would be the 8th patient, right? So I document everything from the lot number, as I said earlier, the lot number, the expiration date, the manufacturer's company, where I gave it, which would be the left vastus lateralis, and how it looks, and how the patient, the infant, took, how he or she reacted to it. So I got the time, my initials, and everything like that. So then I just dispose of everything that I don't need. So that's it.